सीवीडी कार्डियोवास्कुलर डिसीजेज है। ये है क्या और क्यों इतनी ज्यादा बढ़ती जा रही है?
Cardiovascular disease. Cardiac means heart, vascular means blood vessels.
ओबेसिटी की 90 सेंटीमीटर सपोज बेगी हो रहा है तो व्हाट हैपेंस इनसाइड द बॉडी देन?
It's a visible fact. It can be pear shaped, it can be apple shaped, equal vulnerability.
एक टाइम होता था जबकि 50-60 तक कोई हार्ट अटैक का ऐसे टेंशन लेके नहीं चलता था कि मुझे हार्ट अटैक हो सकता है, बट अब कोई 30 ईयर ओल्ड भी सोचता नहीं।
9 factors are responsible for 90% of heart attacks. Clotting जो factors होते हैं, platelet जो होता है, इसके अंदर चले जाते हैं, तो फिर लोगों को हार्ट अटैक होता है, ब्रेन अटैक होता है, नेग अटैक होता है. Your health of the heart is in your hands. Healthy heart is healthy India. Healthy India is a healthy world.
तो फर्स्ट टाइम आपको जब ऐसा पता चला कि आपका हार्ट इशू है तो क्या हुआ था? व्हाट वर द सिम्टम्स, व्हाट हैपेंड?
पसीना आया था, थोड़ा सा अनकंफर्टेबल महसूस हो रहा था। मेरा ईसीजी किया गया तो उसमें मुझे बताया गया कि आपकी ब्लॉकेज 95%। एयरलिफ्ट करके दिल्ली लाया गया।
नमस्ते सर, वेलकम टू हेल्दी हैबिट जाइडस। और आज वर्ल्ड हार्ट डे के दिन ये जाइडस की बहुत नेक कोशिश है कि जो हार्ट, आई थिंक हार्ट के सबसे ज़्यादा जो प्रॉब्लम्स हो रही हैं स्पेसिफिकली इंडिया में जो डेथ्स हो रही हैं, वन ऑफ द मेजर रीजन इज हार्ट फेलियर, राइट? तो उसके बारे में जितना अवेयरनेस, क्योंकि ये ग्राफ है जो बढ़ता जा रहा है, लोग धीरे धीरे और अब तो कोई एज भी नहीं लगी इसकी। पहले ऐसा होता था शायद कि हाँ सिर्फ बड़ों को ही होता था, बट देयर इज नो एज फॉर हार्ट फेलियर नाउ। तो बहुत ही ज़रूरी है कि इसकी हम अवेयरनेस क्रिएट कर पाए। एंड सो मच वर्क, यू आर वन ऑफ द पायनियर डॉक्टर हियर इन द आर्ट इन द दिस सेगमेंट। So I'm super happy and super glad and honored to have you here. So thank you so much first of all for joining us. And अब अगर हम जो शुरुआत करते हैं जो CVD कार्डियोवास्कुलर डिसीजेज हैं, तो क्या है? फर्स्ट ऑफ ऑल मैं सर शुरुआती वैसे करती हूँ कि ये है क्या और क्यों इतनी ज़्यादा बढ़ती जा रही है?
Dear friends, ladies and gentlemen, it's really a great pleasure and honor indeed for me to be here on the platform of Zydus, and especially on a special occasion, World Heart Day. And I'm very happy that the question you asked is very pertinent. We have to know what do you mean by CVD. CVD is a cardiovascular disease. Cardiac means heart, vascular means blood vessels. When we talk of cardiac, there are coronary arteries in the heart, small arteries in millimeters, right coronary artery and the left coronary artery, and they supply blood to the heart muscle. Besides that, we have 1 billion capillaries and 60,000 miles of blood vessels with 60 trillion cells and 6 trillion chemical reactions with 60 neuropeptides, which are happening every second in you and me. So you can imagine what an orchestra we have. We have a physical orchestra, which you are looking at me and I'm looking at you. And second thing, we have an emotional orchestra. And then we have a neurohormonal biochemical orchestra. And then we have a genetic and epigenetic orchestra. And then we have a quantum orchestra. They all are integrated. There is a balance. The time we don't have balance, we fall victim to heart attack or a heart problem.
In any one of them.
For example, if you see the data, worldwide data of CVD, it is 50% to 400 times higher in Asians. Out of all the Asians, India is the highest. The question is why? Because we have got multiplicity of risk factors besides genetics.
Okay.
And there are many risk factors, like for example, in India, people are very obese. If you see the prevalence of obesity is almost metabolic syndrome, what we call it, 65%, more in women as compared to men. And there are various components of obesity, what we call as central obesity. Okay. In Hindi, we call as tone or pot belly. So when the pot belly is more than 80 centimeters in women and more than 90 centimeters are men, they are more vulnerable to premature heart attacks. This is proved worldwide. Okay. The second component is hyperlipidemia, means high cholesterol. And third component is a high blood pressure, hypertension. Fourth component is also a type of cholesterol. And the last component of this metabolic syndrome is high blood sugar. So in short, what I'm saying is obesity is a very important part, high cholesterol is a very important part, and uncontrolled hypertension is a real issue in India. And the other issues are like smoking, excessive smoking, and then stress is a very major part. People are all the time worried for what only known to them only. And sedentary lifestyle, no exercise, and then very fast life and fast food also. And nowadays, devoting more time on a computer screen or on a mobile screen or on the any screen, which also add. Beside this, I must say that there are some emerging new factors like air pollution, noise pollution, mental pollution, and vision pollution, and soil pollution, and the food pollution. So we are polluted being these days, and that's how we fall victim to a premature heart attack. More in India as compared to the western part. If you see the CVD mortality, in Japan it is reduced by 60%. And even if you see in Finland, 60% reduction. In America and in Canada and Australia, 50% reduction. In Western Europe, 25% reduction. But in India, there is a steep rise. The reason is there is a lot of awareness about the heart health. They practice yoga, they practice meditation, and they manage their stress, and they give limited hours for their working. They give time to themselves. And they don't eat now the food which we eat in Indians. There are no pakoras, no samosas, no halwas there. They eat more fruits and vegetables and nuts. So that makes them, of course, they had been smoking. The smoking has reduced significantly. And they sleep adequately in the night, at least for about 6 to 7 hours or 8 hours, which is absolutely necessary. So these changes in lifestyle have made a lot of difference. Optimized lifestyle. Number 2, they are very disciplined. They go for regular checkups. So they are concerned, they have awareness. Awareness is very important. Going for a regular checkup, health checkup maybe every 6 months after a certain age, every 3 months after 70s or 80s. And most important thing is early diagnosis and timely treatment. And they are adherent to the treatment. They have a good compliance. As compared to Indians, they decide when to take, when not to take, how much to take. They never follow the doctor's instruction. वो कहते हैं हिंदी में डॉक्टर सब कहते रहते हैं हमको वो करना चाहिए जो हमको सूट करता है. There is difference. Perceptions are different. So I think we need a change from the perception. And that's how we can reduce the prevalence of heart disease in India. If you see the theme of World Heart Day from World Heart Federation is use your heart for action. That's the main theme. Last year, if you remember, the theme was use your heart and know your heart. How do we know our heart? By our own karmas. So if our karmas are perfect, if our vision is perfect, and if you are disciplined in lifestyle, we should know when to eat, how much to eat, what to eat. But when there is no discipline, you are eating to oblige somebody, that will cause all kind of. So overconsumption, malnutrition, and underconsumption, malnutrition is very common in India. That is the main problem. We are here to oblige somebody else. And that's how we eat wherever you go, irrespective of the time. If you call me at home and you offer me some sweet, I won't mind because I have to oblige you. So there it's not for obligation. They are very straight. I remember when I was in USA for my 9 years training in the University of Alabama and University of California. There was one Dr. Swan in Gaines, very popular man. He's a world authority. When I went to meet him there, it was 1 o'clock and I was in conversation with him. And 1 o'clock he stopped conversing with me. As an Indian, I didn't like it. But he opened his bag, took out 2 apples and a bread slice and a cup of coffee and eating in front of me. He did not even offer me. So me as an Indian, I didn't like it. But after he finished, he said, my time was 1 o'clock. So wherever I am, how serious the meeting is. So the discipline is very, very important there. Education is very wide there. Awareness is very wide, whether by digital media or print media, as you are happening here, or electronic media, or any other media they use. So that kind of awareness, I think, is the need of the hour. The main theme of the World Heart Day is be aware of a healthy heart. So healthy heart is healthy India. Healthy India is a healthy world. हिंदी में कहते हैं स्वस्थ दिल स्वस्थ भारत. अगर स्वस्थ दिल ही नहीं है तो स्वस्थ भारत कैसे होगा? और स्वस्थ भारत नहीं होगा तो स्वस्थ वर्ल्ड कैसे होगा, संसार कैसे होगा? So I think that's what our theme is, and this is how we educate our people now.
Yeah, wow. I mean, so important and so much information in this last 10 minutes. But मैं शुरुआत से इसको थोड़ा और ब्रेक डाउन करना चाहूँगी सर. तो आपने जो बोला कि जेनेटिक्स वाज वन रीज़न, बट उसके बाद जो लाइफस्टाइल चेंज हुआ है पूरा बिकॉज ऑफ ऑल द प्रॉब्लम्स, उसकी वजह से बहुत कि बाहर जो है अपार्ट फ्रॉम इंडिया लोगों ने लाइफस्टाइल बहुत कंट्रोल में रखा है, एंड वी आर नॉट, बिकॉज वी आर नॉट अवेयर.
In Indians, genetics is one part. We are more prone. If you see, 40% of genes are abnormal in Indians. Indians, wherever they are, whether in India or in any part of Asia or in the Western world, they are equally vulnerable to get heart problems. The disease is diffuse, the disease is premature, 10 years earlier, and multivessel disease. Because they are associated with multiple complications like uncontrolled hypertension, uncontrolled diabetes, uncontrolled obesity, uncontrolled high cholesterol, everything is uncontrolled. So this adds to the risk factors, and that's how Indians are more vulnerable. These things we don't see in Americans or we don't see in the Europeans. They are more concerned about their health. So we need to enhance the health awareness in India. That will really help us to fight this menace, rising menace of heart disease.
So अगर मैं इससे स्टार्ट करूँ, जैसे आपने फर्स्ट बोला ओबेसिटी की, अगर इफ देयर मेन है तो उनका 90 सेंटीमीटर है तो दे गेट ऑन द रिस्क. क्या होता है, मतलब व्हाट हैपेंस, लाइक ओबेसिटी की 90 सेंटीमीटर सपोज बेगिंग हो रहा है तो व्हाट हैपेंस इनसाइड द बॉडी देन?
It's a very important question. The whole world is in the group of what we call cardiometabolic syndrome. It's a visceral fat जो हमारे अंदर होता है, visceral fat, and it can be pear shaped, it can be apple shaped, equal vulnerability.
Visceral fat is basically जो बॉडी के अंदर पार्ट्स के ऊपर जमा हुआ है.
That's it. And if there is a fat here, so if you see in front of a heart, there is a fat. If you see in front of a liver, there is a fat. If you go in the carotid arteries here, you'll find a fat. If you see in the brain, there is a fat. So we predict this based on here. So we say pot belly is the most powerful predictor of CVD. CVD, you ask me, is cardiovascular disease. And when I say vascular, means all the vessels. And vessels include not only coronary arteries, where the prevalence is about 14% in Indians, as compared to urban population, as compared to the rural population, where it is half. And then even we have hypertension, which is 40% in young adults. But as the age advances, the hypertension increases. For example, at the age of 50, 50% hypertension. At the age of 60, 60% hypertension. At the age of 70, 80% hypertension. Diabetes, 10%. Metabolic syndrome or obesity, 65%. High cholesterol, 80%. If you see carotid artery disease, 5%. If you see kidney artery disease, 5%. And if you see peripheral vascular disease in the legs, 10%. So that is the data. So whole vessel, everywhere the vessels are affected by nothing but cholesterol deposits. So cholesterol deposits is a real challenge for us. What we call is atherosclerosis. जैसे कहते हैं हार्डनिंग ऑफ आर्टरीज. अगर हमारी ब्लड वेसल में हार्डनिंग हो गई या कोलेस्ट्रॉल डिपॉजिट हो गया तो उसके बाद में जो एंडोथेलियम होता है, हमारी जो ब्लड वेसल होती है उनके 3 लेयर होते हैं. पहला होता है इंटिमा, फिर मीडिया और फिर एडवेंटिशिया, 3 लेयर है। इंटिमा मीन्स अंदर वाला, और ब्लड जो फ्लो करता है, अगर इंटिमा में कहीं इंजरी है, जो रिस्क फैक्टर से इंजरी होती है, स्मोकिंग से बता रहा हूँ मैं आपको, या स्ट्रेस से, जब भी इंजरी होगी तो जो एपोलाइपोप्रोटीन होते हैं वो पेनिट्रेट कर जाते हैं अंदर बाय ऑक्सीडेटिव स्ट्रेस, और सब इंटिमल एरिया में फिर वहाँ जाके कोलेस्ट्रॉल डिपॉजिट हो जाता है, उसकी फैटी स्ट्रिक्स, और फैटी स्ट्रिक्स फिर वो प्लाक बन जाती है। तो प्लाक में भी सॉफ्ट प्लाक और हार्ड प्लाक। अब जो हार्ड प्लाक होता है वो तो कैल्सीफाइड हो जाता है, उसमें फिब्रिन ज़्यादा होता है। जो सॉफ्ट प्लाक होते हैं वो ज़्यादा वल्नरेबल होते हैं, और जो ये हार्ड क्लॉट भी हैं, सो कॉल्ड प्लाक, ये प्लाक्स आर वल्नरेबल। व्हेन यू से वल्नरेबल मीन्स इनमें इरोजन हो जाता है, खरोच पड़ जाती है, या इनमें अल्सर हो जाता है, या फिशर हो जाता है, या ये रप्चर कर जाते हैं। अब मेरे से आप पूछेंगे रप्चर क्यों करते हैं, रप्चर कब करते हैं? रप्चर जब करेंगे इफ आई हैव ए फिट ऑफ एंगर, miss your heart attack. If I smoke too much, miss your heart attack. If I have uncontrolled hypertension, 200 by 120, this plaque will rupture. So any emotional instability, you should know you and me have two emotions, no third emotion. The first emotion is a emotion of fear, and second emotion is the emotion of love. From fear originates what we call as jealousy, hatredness, anger, vengeance, vindictiveness, hostility, cynical behavior, frustration, suppression, repression, depression, and disturbed ease, what we call as disease. The origin is from fear, insecurity.
So what happens, again, I'm asking the same question because I want to understand ki when these emotions are appearing,
Good
what is
points.
happening?
Good points. These are all neurohormonal mediated. Whenever there is any negative stress, which I just mentioned to you, negative emotion, there is a liberation of epinephrine, norepinephrine, and cortisol. These are three jittery molecules in simple language. These jittery molecules increase the sympathetic activity in our body. Heart beats fast, blood pressure goes up, and that causes or mediates or modulate the rupture of the plaque. There are various pathways. Like we have a what we call a SNS pathway or sympathetic pathway. Then we have a RAS pathway, renin-angiotensin-aldosterone system pathway. Then we have NPS pathway, a cellular pathway. Then we have a coagulation cascading, clotting pathway. And then we have a mitochondrial pathway और calcium signaling. ये सब pathways हैं, ये सब तरीके हैं. इन सब तरीकों को हम इन pathways को एक्टिव कर देते हैं. इनको नॉर्मल होना चाहिए तो इनको हम हाइपर एक्टिव कर देते हैं. हाइपर एक्टिव से उनका नेगेटिव इन्फ्लुएंस होता है. So negative emotion are worst thing in life. We must always have calmness, attitude of gratitude, an attitude of calmness. Then the life is very smooth. Hell is here, heaven is also here. How can we get a heaven? When we have emotion of love, emotion of compassion, altruism, empathy, sympathy, peace, humility, harmony, and positive health. Choice is ours. They're all the components of stress also. What we call negative stress is a distress. Positive stress is eustress. So without stress, there is no life. You had all the stress, you're coming from Ahmedabad, catching a car, going to the flight, reaching here in time, finishing everything in time. This is stress. But if you enjoy this stress, then this is positive stress, eustress. But if you're distressed, you're worried, you're anxious, you're palpitating, that's a distress. Who decides this? It's our own choice. How do we make the choice? By our own perception, by our own thoughts, by our own interpretations, by our own experiences, and our own choices. And this is very simple. A simple way, a public point of view to ask the morsel of food that I eat, the emotions that I experience, the stresses that I face, the temper that I lose, the water that I consume, the cigarette that I smoke, and the alcohol that I take get metabolized by 60 trillion cells, 6 trillion chemical reactions, 60 neuropeptides, and become your and my heart. So where does it originate? It's not so simple. So we have to regulate our life, everything, whatever we eat, we are. We are whatever we eat. We are whatever we think. We are whatever we face the stress on a daily basis. They all affect on the heart. If you don't take a rest and all the time working, Napoleon Bonaparte used to sleep for 3 hours and then 2.5 hours back. So we can't become Napoleon Bonaparte. We have to follow the statistical data. There's 7 to 8 hours rest in the night is a must. We are not owl that we are awake for the whole night. There is a whole circadian rhythm within us. So if you play with the circadian rhythm, you will fall victim to premature heart attack. I personally feel the first important cause is lack of discipline and highest stress in life. Fast life, fast food, everywhere fast. And then that cause all the problems.
मतलब हर इंसान आई थिंक जो एक नॉर्मल इंसान है ये दो चीज़ बहुत नॉर्मली सुनता है कि मोटे मत हो, स्ट्रेस मत लो, बट क्यों, क्या होगा उससे, अंदर तुम्हारी बॉडी में क्या हो रहा है, एंड सो मच स्ट्रेस. मतलब ऑनेस्टली आई एम फीलिंग दैट फियर इमोशन बिकॉज आई एम एक्चुअली imagining ki whatever is happening inside my body if I'm eating, like you mentioned, fast food, or I'm eating
There's a very
outside.
simple expression. I'm here to confuse you. And the expression is like this. As is the quantum soup, so is the quartz. As is the quartz, so is the boson. As is the boson, so are the proton, neutron, and electrons. And as are the proton, neutrons, and electrons, so is the DNA. And as is the DNA, so is the mitochondria. As are the DNA and mitochondria, so are the genes and epigenes. And as are the genes and epigenes, so is the perception. As is the perception, so is the thought. As is the thought, so is the interpretation. As is the interpretation, so is the experience. And as is the experience, so is the choice. As is the choice, so is the lifestyle. And as is the lifestyle, so is the mind. As is the mind, so is the body. As are the mind and body, so is the health of the heart. And as is the health of the heart, so is the world around you. So where does it originate? It's not so simple. It's very complex.
Yeah, but yeah, I just, oh my God, so true.
So what is the message is? We should be very kind. We should be very humble. So I say kindness in words create confidence.
But so that's what is becoming difficult in this
Kindness
cycle.
in thinking create performance.
Major
And kindness in giving creates love. And kindness in loving creates happiness and healthy heart. Very simple. But nobody follows this formula.
Nobody following this. वो जो एक रेस है, because मतलब वो जो आता है ना वहाँ कि कितने अब सेलिब्रिटीज का तो इतना आ ही रहा है because of stress situation of course, and young generation like you started in the way side कि एक टाइम होता था जबकि 50-60 तक कोई हार्ट अटैक का ऐसे टेंशन लेके नहीं चलता था कि मुझे हार्ट अटैक हो सकता है, बट अब कोई एक 30-year-old भी सोचता है कि मैं ज़्यादा स्ट्रेस करूँगा तो मुझे हार्ट अटैक हो सकता है. आई थिंक दैट्स व्हाट यू मेंशन इज द मेजर रीजन, the stress and the lifestyle which has like changed beyond imaginations.
Young heart attacks. You know, I remember the data now. 50% of heart attacks now occurs less than 50 years of age. And 25% of heart attack less than 20 years of age. I never heard of all this. So it's very shocking.
20 years
20. People don't exercise. They smoke when they're in school age. I'm telling you, I give lectures in schools. So I'm amazed what kind of drugs they take, drug abuse, hallucinations. You know, they take cocaine. So I think it is not only happening in the Western world, but also in India now. Even the tobacco, they use marijuana and bhang and ganja, so many things they take. So substance abuse is also one of the important cause. And lack of exercise, then again late night, same factors. And as I mentioned to you, a lot of time on a computer screen all the time on a computer screen, all the time on a mobile. So it changes the mindset of a person. So you need to have a mindset which is very, very composed, stable and disciplined. Then the life is very, very good.
बट सर इसमें जो ऐसे बोलते हैं कि लॉट ऑफ पीपल जिन्हों में पूरी लाइफ जो होता है कि एक जो स्टिग्मा है कि मैं आई हैव ड्रंक अल्कोहल, मैंने स्मोकिंग भी किया, मुझे तो कुछ भी नहीं हुआ, माय हार्ट इज एकदम हेल्दी। जैसे अभी आप आपके पेशेंट से भी बात करेंगे जिन्होंने कुछ नहीं किया था बट स्टिल ही हैड एंजियोप्लास्टीज। आई मीन वो चीज़ है इसलिए कि मैं तो चिल कर सकता हूँ क्योंकि मेरी लाइफ में कुछ है नहीं, तो वही चीज़ को लेके। और फिर जो आपने बोला कि इंडिया में अवेयरनेस नहीं, क्योंकि वो अपने हिसाब से चलते, दे डोंट वांट टू एक्सेप्ट कि उन्हें कुछ हो सकता है, उनके लिए आप क्या बोलते हैं?
Winston Churchill was like that. He was a chain smoker, but he never had a heart attack till 94, 93. So exceptions are there. We go by statistical data. We see lakhs of people and come to a conclusion. One individual has no meaning because their genes are different. But if you take the genetic aggression, genetic expressions are very different. Lifestyle as a whole one should take. There was the data published in Interheart study. This was a very powerful study in 2004. They mentioned 9 factors are responsible for 90% of heart attacks. What are the 9 factors? Number 1, high lipids, high cholesterol, very important, 50%. Number 2, hypertension, I mentioned to you. Number 2. Number 3, obesity, I mentioned to you. Number 4, smoking, I mentioned to you. Number 5, psychosis, neurosis, psychological problems, stress, same thing. Number 6, diet, no fruits, no vegetables, all the time samosas, pakoras and halwas. Number 7th, which is very important, lack of sleep. All those factors I mentioned to you. And then of course, in these patients who are highly used to all kind of pollutions, all pollutions I mentioned to you, they fall victim to a premature heart attack. So I say, if you really want to prevent heart attacks, we should focus on primordial prevention, primary prevention 25%, 25%, secondary prevention 25%, and tertiary prevention equally. If we have a preventive strategy equally, and I feel that there should be a lot of preventive cardiology setups, but there is hardly any.
प्राइमरी और सेकेंडरी में आपने क्या डिवाइड किया?
एक प्राइमोडियल होता है कि जब रिस्क फैक्टर होते ही नहीं है, एक प्राइमरी होता है कि रिस्क फैक्टर होने ना दे, एक सेकेंडरी होता है जब रिस्क फैक्टर हो गए उसको बढ़ने ना दे, एक होता है टर्शरी जब आपकी एंजियोप्लास्टी हो गई, जैसे आपने सुना था पेशेंट को भी, अब एंजियोप्लास्टी हो गई तो ही इम्प्रूव्ड हिज लाइफ. Before that, he never knew when to go for a walk. So he knows now what is walking, what is jogging, what is swimming, what is dancing, what is cycling, and what is treadmilling. But before that, he never knew all these things. So some people, they learn after they fall victim to the disease. So this is very important that heart-friendly exercises should be done by everybody right from childhood. Unfortunately, most of us are busy in earning money and losing health of the heart. And then we are busy and losing that money. So mindset need to change. Why should I fall victim to a heart attack and then take crores of rupees to get my heart transplant? I got one patient admitted upstairs, very big man. I won't tell you the name of the person because it is unethical. He's got very big man. You want to know him very well. His ejection fraction is only 18%. He got a device in his heart and he's only 42-year-old. And he's a victim of faulty lifestyle. Richest man of India. But at the age of 42, he's gone. And I don't think he'll survive for more than 6 months or 1 year. Every 15-20 days in the hospital. So pumping action is gone, heart is totally damaged, chain smoker, sleeping late nights, working hard, level of stress is very high, all the time in a angry mode. People used to call him, oh, anger is going. How they define? So, no, what is the issue? Ego, arrogance is all there. Negative emotions, which I mentioned to you. So if you are positive emotion, you will live long. If negative emotion, you are not going to live long. So we learn ourselves how to lead a disciplined life, like the patient was telling to you. He didn't tell you anything more. And that makes you very happy. I tell you in short, there's very nice expression. I'm very fond of expressions. And this expression is, we all should know that we are all spiritual beings with a transient human experience. We are not human beings with a transient spiritual experience. This is what we think. We go to a temple for 10 minutes, पूजा कर ली, बस भगवान हमारा ख्याल रख लेना, हमारे ध्यान रखना, हमारे नोट कमाने आज, बस काम हो गया. That's not the answer. We are spiritual as a whole. Only 5% is human experience. ये उल्टा है. हम मंदिर में जाते हैं, पूजा कर लिया, मंदिर में कुछ नहीं है. Nothing in temples, all within you. We should know our physical body, our subtle body, and our causal body is a quantum body. If we do meditation every day and do yoga every day, yoga, all the 8 limbs of yoga, people do postures here and there, and they say everything is fine. No. Yoga means yama. Yama means do's and don'ts, what to do and what not to do. Niyama means discipline, which I'm talking. Asana means postures. Pranayam, breathing exercises. Pratihara, contemplation. Dharana, dhyana. Dharana means concentration. Dhyana and contemplation, meditation. And then last one is transcendence. All the 8 limbs of yoga to be practiced together. That is a perfect yoga. आजकल तो लोगों ने बोल दिया emotional yoga, playing yoga. I don't know what kind of yoga
They talk about chakras, but then they don't know what is chakras and how.
Chakra is a big thing.
Big thing is
I do every day chakra meditation. Chakra meditation, nothing but energy meditation. We have 7 zones in our body. First is what we call as sacral zone. In our language, we call it, I don't remember Sanskrit words. Sacral zone means we meditate, concentrate on that, and the color of the chakra is red, security. Then we have an orange chakra, which is known as perineal chakra. And third chakra is a upper abdomen, what we call as, which is yellow color, and that is for willpower. There is no center of willpower here. Willpower is generated here. If you concentrate and meditate every day here. Then the fourth chakra is a heart chakra, which is green in color. And the components of this are love, compassion, peace, and harmony. Are they available in the market? No, they are not available in the market. They are within us. And the next chakra is thyroid, what we call as faith. आप कहते हैं मेरी कसम. Nobody knows what you're talking, but we do like this, hand like this, and then we keep like this. That is faith. And the last one is a crown chakra, which is what we call as a violet color. So every color is a meaning. Every chakra has a meaning. But what is the aim? Energize you. So if you practice chakra, I do chakra meditation for the last 30 years. Today I'm 74. I control the whole world now. I wrote almost 54 books, which are spread all over the world. And I'm very compassionate with everybody. It helps me and makes me live longer. So it's all in your hand. Your health of the heart is in your hands. If you go to the doctors, I think it's your problem.
And it is said that you can actually heal your body through that also. मतलब जो बोलते हैं कि lifestyle and this your mindset can actually heal your body is such a great mechanism कि उसमें खुद capacity है कि वो अपने आप को heal कर पाए.
Healing and holding and health are same. Healing, holy, and health are synonymous. But we need to understand.
Wow.
That's very important. So you have to heal yourself. We always say tranquility is truth, truth is beauty, beauty is bliss, and bliss is divine, and divinity is health of the heart. But who is divine? Known to God only.
So if I ask you, sir, जैसे you have spoken about different reasons, risk factors because of which heart failure happens, तो उसमें अगर मैं percentage wise पूछूं, like अगर मैं ये तीन चीज पूछूं, one is your genes, second is your lifestyle, and third is hypertension and blood sugar and all of that. So किस चीज का highest percentage है reason में?
The highest percentage we see here, as I mentioned to you, the inter-heart study, more than 50% is because of high cholesterol. Number 2, uncontrolled hypertension. More than 50%, 40-50%. And number 3 is obesity. And then uncontrolled diabetes, 10%. Then smoking. Then stress. And then sleep disorder like obstructive sleep apnea. खराटे भरना. Obstructive sleep apnea. सोते हैं रात को खराटे भरते हैं, सांस रुक जाता है. That is responsible for heart attacks. And then consumption of less fruits, no vegetables, eating all the time non-vegetarian, meat, chicken, fish, eating all the time non-veg. This is full of free radicals. Yeah, there are no antioxidants much, especially meat is full of fat, so they should be avoided. And of course, lack of exercise or sedentary lifestyle. So these are all the 10 factors, besides the latest new factors which I mentioned to you, mental pollution, air pollution, all the pollutions. And then of course the TV screen or your mobile screen and all those things. They are emerging risk factors. So they are all the risk factors responsible for premature heart attack.
ठीक है, and जैसे number one आपने cholesterol बोला, तो what's the main reason?
This is only, in India, the main reason for high cholesterol is twofold. Number 1 is acquired, and number 2 is genetic. Genetic is basically what you call as homozygous hyperlipidemia or heterozygous hyperlipidemia. Homozygous means both the parents have got high cholesterol. Since genes are abnormal, so you also get it, and by the time you're 30, you're dead. Then there is heterozygous. In heterozygous, the LDL cholesterol. There are bad cholesterol and good cholesterol. The bad cholesterol is like LDL or also triglycerides and VLDL and apolipoprotein A and B and also trans fats and also remnant fats. There are various types of bad cholesterol in total cholesterol. Good cholesterol is only one, what we call it HDL. When the bad cholesterol rise, it is highly vulnerable, especially LDL. So the whole focus today in our cardiologist forum is target LDL. Whatever drugs we get, for example, statins, atorvastatin, we use a lot atorvastatin. Even I consume atorvastatin since 30 years now.
It's precautionary.
Preventive. Yeah, so that my total LDL is 27. So people LDL is 300, 400. So they are vulnerable. So everybody should take atorvastatin from the age of 30. I remember a Dr. Inas from Chicago. He came to India and he was delivering one of our conference and he said, ideally, Indians should take atorvastatin when they're 13, 1-3. But now the guidelines coming from CSI, everybody should go for a lipid checkup at the age of 18 or 20 years. I agree with that, 100%. So that if you find the cholesterol is high, maybe you have more genetic component and more acquired component. Acquired means what we eat, eating the wrong things at the wrong time, in the wrong place, in a wrong manner, in a wrong dose, in a wrong environment. Hot fried food, pizzas, fast food. I don't know to name the companies, but all those fast food which are detrimental for our parathas, pakoras, all the time. I can give you an example. There was a guy from Chennai who came from MBA in Delhi. He used to leave his parents. He was staying next to one of the leading organization preparing fast food. I won't tell you the name. And he will go for a breakfast there, lunch there, and dinner there. In 2 months, he had a high blood pressure. He became very obese. He gained 20 kg weight. And he was sick. When he came to me, I checked his lipid profile, all high. Ultimately, parents came, took him back to Israel. Because he was alone, nobody was taking care of him. He was going for the fast food. Morning breakfast, lunch same, training. Women, they fall victim to this because they're brunching, lunching, everything outside. And they go for kitty parties very often. So that's how they make a victim. And they don't know what they're eating at the time because they're talking so much. So they eat the wrong things. So I think eating is very important. Number two, taking excessive alcohol. It also increases triglycerides. Smoking also increase. Sedentary habits. All the time you're sitting. So you're bound to accumulate cholesterol. You'll become very obese. You have to be very active. I always say, use it or lose it. You have to use your body or lose your body. I also say, move it or lose it. You have to move. I go to Lodi Garden for last 45 years. So message is very clear. When I go to the garden, I am with the garden. I am not with the hospital. And I'm not with the patients. You must look at the sky, look at the moon, look at the stars, look at the galaxy, look at the birds, look at the green plants. They energize you. But I've seen people who come for a morning walk, they talk of evening meeting. When they come for an evening walk, then they talk of a morning meeting. So they are not there. The presence is very important. Where you are, that's very important. So I think that's what the cause of high cholesterol. The high cholesterol is real challenging. 80% of Indians are suffering from high cholesterol. And if you see the data of ICMR and WHO and Ministry of Health, Government of India, 90% of Indians are hypertensive, which is uncontrolled. Only 10% controlled hypertension. तो क्या होगा इंडिया का? तो मेटाबॉलिक सिंड्रोम, मोटापा जो है, 65% obese. 2 women, 1 man. So it is just the double in women.
The medicine that you mentioned, so usme there are no side effects. Like anybody can take it.
Torvastatin is a very, very good drug. And there is a huge data to support what I'm saying by statement. Because there is another medicine by the name of rosuvastatin. Atorvastatin has been subject to huge plethora of studies. Rosuvastatin is also a very good drug, but more potent. So I find a lot of patients for atorvastatin, there are no side effects. Some people have side effect like 1% to 3%, what they call as mild muscle weakness and all that stuff. But if they take some Q enzyme, which is the cause of weakness because of statins, they don't get any problem. I'm taking atorvastatin for last 30 years, as I just told you. I'm fine. I feel very great. When I see my lipid profile report, I get every 6 months test done.
But बहुत बार ऐसा होता है ना, जैसे like kidney patients हैं who cannot take much painkillers and everything because they have probably one kidney or some less of function and everything, so they can also take it.
Atorvastatin is not given to those who are having a statin intolerance. Means you take one tablet of statin, you can't get up. You're so weak. And you get so pains and aches, shoulder and all. So there are only 1 to 1.5% patients. Number two, atorvastatin has got a lot of pleiotropic effects. Pleiotropic is they're anti-inflammatory. And long term, they are very, very effective. They prevent the deposition of cholesterol in the blood vessel wall. So on the contrary, if a patient had a heart attack, we give 80 milligrams or 40 milligrams of atorvastatin these days. And as a prophylactic, I tell every of my patients, you must have a small kit which should contain atorvastatin, 40 milligrams, and take an aspirin, 300 milligrams. It should be with you all the time at your home.
These 3 medicines.
Yeah, very important. And then we also give in the patients who have a heart attack a drug which is like a blood thinner besides aspirin is what we call as ticagrelor or prasugrel. So ticagrelor we commonly use in all these patients, and they have to take it at least for about 1 year or so after the angioplasty. But long term, they have to be on aspirin and statins. Statin for the whole life. So statins or atorvastatin or rosuvastatin, basically they are like a panacea. They are the game changers to give you a long life. It's very safe. And I think I am a very fan of atorvastatin, and I feel there should be some consensus. Atorva versus Rosuva. I'm not against Rosuva. And I'm not favoring Atorva. but the data is what is best for the patient should be given. For more potent medicine like Rosuva should be given in the acute stage, but on a long-term basis, Atorva is the superior drug.
Okay, so can you repeat the three medicines you mentioned that everyone should have? But these medicines are those which, if anybody is having a heart attack or something, they can take it right there.
They should take it, they keep in the kit. How do they get their heart attack? They must have a severe chest pain. Not like that. If there is severe chest pain, unbearable, choking feeling, suffocation feeling, as if there is an elephant leg on you, or pain in the left arm, or right arm, or back, or chin, or in the teeth, unbearable pain, or in the ears, profuse sweating, feeling of exhaustion, and feeling of sinking feeling, abrupt onset, unbearable, and short lasting. It's very difficult. So you can easily say the life saving is atorvastatin, 40 to 80 milligrams, aspirin, 300 milligrams. Everybody should take. Third medicine which we give to be kept at home, either ticagrelor, 90 milligrams, or we give clopidogrel. Clopidogrel is another tablet where we give about 300 milligrams or 600 milligrams these days. Whichever is practical, patient can take it. Take it and go to the hospital nearby.
To be taken together.
Yeah, don't go to chemist shop, or don't take Ajwain or some powder or something because your spouse is told gas hai. वो gas नहीं है. You should know, awareness is very important, what a heart attack is and what you should keep at home as a life saving. If you take this, 50% of life can be saved. And then go to the hospital, then they should go what we call as pharmacoinvasive approach. Pharmacoinvasive approach means initially we give a drug which is known as the clot buster, TNK, clot buster. And the TNK we give as a bolus dose. And then within 3 hours to 24 hours, we will do angioplasty. Angioplasty and stenting, they are very, very effective. So if you ask me, the definition of statin is pan-vascular medical angioplasty. Pan-vascular. All the blood vessels are taken care of. But by angioplasty, only small, tiny vessels. कहाँ स्टेंट लगाएंगे हम? बॉडी में इतने ब्लॉकेजेस हो रहे हैं, कहाँ स्टेंट लगेंगे? So the best answer, I was discussing with a very famous doctor from US. His name is Dr. Jagat Narula, who is also the trustee of American College of Cardiology, and he's also in Texas Heart Institute, and he's the president of World Heart Federation now. He said, HK, why not we should have a LLP, lipid lowering pill. Okay. If you have a lipid lowering pill, we can save a lot of people. Take it like a global initiative. So here we are, we can talk to the industry and think of a lipid lowering pill in the form of atorvastatin.
For the audience, sir, if you can just describe in easy terms, lipids क्या होते हैं और बॉडी में क्या काम करते हैं?
कोलेस्ट्रॉल जो होता है बड़ी सिंपल चीज़ है, बहुत एसेंशियल है लाइफ के लिए. अगर ज़िंदगी में कोलेस्ट्रॉल नहीं हो तो लाइफ नहीं है. हमारे जो सेल मेम्ब्रेन है, हमारे जो हार्मोन्स हैं और हमारे बॉडी में जो ग्रोथ हार्मोन है और जो भी सेक्स हार्मोन्स हैं, दे आर ऑल मेड अप ऑफ कोलेस्ट्रॉल. लेकिन जो कोलेस्ट्रॉल की मात्रा है वो सीमित होना चाहिए. अगर कोलेस्ट्रॉल की मात्रा 130 से ज़्यादा है तो वो ज़्यादा कोलेस्ट्रॉल है. जिससे एज बड़ी होती है तो इसका लेवल कम होना चाहिए. आजकल जो रिकमेंडेशन है, जिनको और रिस्क फैक्टर हैं लाइक डायबिटीज़ या हाइपरटेंशन, उनका कोलेस्ट्रॉल 70 से भी कम होना चाहिए, 50 होना चाहिए. So this is very important. Then the triglycerides should be less than 130.
Triglycerides भी यही अलग कोलेस्ट्रॉल का ही एक फॉर्म.
तो ये लेबोरेटरीज जो है ना, उनको कुछ पता नहीं है. वो बच्चे का भी वही लिख देते हैं, बुढ़ापे का भी वही लिख देते हैं. आई पर्सनली फील कि जो हमारी एकेडमिक सोसाइटीज़ हैं उनको डिफाइन करना चाहिए कि 30 साल में ये होना चाहिए, 40 साल में ये होना चाहिए, 50 साल में ये होना चाहिए. दे आर कन्फ्यूज. वो आते हैं हमारे पास, बोलते हैं सब लिखा सब नॉर्मल है, 100 से कम होना चाहिए. They don't know. It varies from age to age and risk factor to risk factor. So जो कोलेस्ट्रॉल है ये एक वैक्सी सब्सटेंस होता है जो हमारी बॉडी में पाया जाता है और इसका लेवल नॉर्मल होना चाहिए. अगर लेवल ज़्यादा होगा तो हमारी पूरी नाड़ियों में, जो मैंने बताया, 1 बिलियन कैपिलरीज एंड 60,000 फीट ऑफ ब्लड वेसल्स, सब में ये कोलेस्ट्रॉल डिपॉजिट हो जाता है और ये लिपिड होते हैं और इसको लिपिड बोलते हैं. और ये हमारी सारी जो वेसल्स है वो हार्ड हो जाती है, और जब ये टूटता है तो फिर क्लॉटिंग जो फैक्टर्स होते हैं, प्लेटलेट जो होता है, इसके अंदर चले जाते हैं और वहाँ खून का थक्का जम जाता है। उसको बोलते हैं खून का थक्का हमारी धमनियों में जम जाता है, और धमनी में आर्टरीज। तो फिर लोगों को हार्ट अटैक होता है, ब्रेन अटैक होता है, नेक अटैक होता है, नोज अटैक भी होता है, हाइपरटेंशन होगा तो ब्लीडिंग हो जाएगी, आई अटैक भी होता है, लंग अटैक भी होता है। ये सारे लंग अटैक क्लॉट से होते हैं और ब्लीडिंग से होते हैं। तो ये सब चीज़ें कंट्रोल करना चाहिए। जो रियल चैलेंज है, मैंने एक पूरी टेक्स्ट बुक लिखी है ऑन एडवांसेस इन द स्टैटिन्स, और अभी जो नेक्स्ट बुक हमारी बुक आएगी नेक्स्ट ईयर, टेक्स्ट बुक है ऑलमोस्ट 1200 पेजेस, इट विल बी एडवांसेस इन लिपिड थेरापी इन 2025 एंड बियॉन्ड। कितना एडवांस हो गया है। आजकल एक नई दवाई आई है, उसे कहते हैं इनक्लिसरान, एक इंजेक्शन 1 लाख का आता है, वो 1 से 6 मंथ्स। PCS का 9 इनहिबिटर, वो भी ऐसे ही है, ये लंबे टाइम तक। लेकिन जिन लोगों को स्टेटिन इंटॉलरेंस है, या जिनको होमोजाइगस डिस्लिपिडीमिया है, या हेट्रोजाइगस है और बहुत हाई LDL है जो स्टेटिन से कम नहीं होता है, उन लोगों को, या जिनको पोलीवेस्कुलोपैथी है, मतलब हमारे आज पेशेंट एडमिट है मेरे यहाँ कि 4 बार एंजियोप्लास्टी हो चुकी है, फिर भी डिस्कम्फर्ट हो रहा है उसको, तो ऐसे लोगों को ये इंजेक्शन लगाना पड़ता है 1 से 6 मंथ्स। तो ये भी एक रिवॉल्यूशन है ट्रीटमेंट में। इसके बारे में डेटा कम है, ओवर अ पीरियड वी हैव गुड डेटा। फिर जीन थेरेपी होती है, फिर प्लाज्मा फेरेसिस होता है, फिर बेरेटिक सर्जरी होती है, बहुत चीज़ें होती हैं। और कई बार लोगों को देखा है कि जिनका कोलेस्ट्रॉल ज़्यादा होता है उनको गॉल ब्लैडर स्टोन हो जाते हैं, वेरी वेरी कॉमन।
आपने जैसे सीवियर हार्ट अटैक जो हुआ उसका एक हमें पूरे सिम्टम्स बताए, तो मिनी हार्ट अटैक, क्योंकि जनरली वो हार्ट अटैक्स लोग अवॉइड कर देते हैं कंसिडरिंग इट्स अ चेस्ट पेन, उन दोनों में कोई डिफरेंस होता है?
एक होता है, इसे कहते हैं एंजाना पेफर्ट, मतलब कि आप जब चलते हैं तो आपको छाती में दर्द होता है, दैट इज नोन एज एंजाना पेफर्ट। हार्ट का ही पेन है, लेकिन उसमें आपके जो हार्ट की नाड़ियाँ हैं वो 85 to 90% ब्लॉक है, तो डिमांड सप्लाई का जो रेशियो है वो कॉम्प्रोमाइज्ड है। जब रेस्ट पेन होता है मोर देन 95% 100% ब्लॉक होता है, तो उस टाइम रेस्ट पेन होता है, तो उसको बोलते हैं एक्यूट हार्ट अटैक, ACS। एक होता है अनस्टेबल एंजाना, ये जो लेटे लेटे या बैठे बैठे पेन हो रहा है, आप चल नहीं रहे फिर भी पेन हो रहा है, कभी आता है जल जाता है तो चल जाता है। फिर एक होता है एंजाना पेफर्ट, तो ये पेशेंट थोड़ा लिंगर ऑन करते हैं, जिनमें इंटेलिजेंस होता है वो डॉक्टर के पास जाते हैं। जैसे वो पेशेंट एडवोकेट ने बोला आपने कि मेरा थोड़ा डिस्कम्फर्ट हुआ, बहुत ज़्यादा चेस्ट पेन नहीं हुआ, स्वेटिंग हुआ, सो ही वेंट टू द डॉक्टर एंड दे फाउंड 95% ऑब्स्ट्रक्शन। तो इसको कोई किसी को भी तकलीफ हो, जल्दी जाना चाहिए डॉक्टर के पास, ECG कराना चाहिए, इको कराना चाहिए, ट्रोपाई कराना चाहिए, और इफ रिक्वायर्ड CT एंजियो या कोरोनरी एंजियो, वो सब करा के डायग्नोसिस को एस्टेब्लिश करना चाहिए। ब्रेन में भी होता है, किसी को कहीं वीकनेस हो गई, इग्नोर नहीं करना चाहिए। लोग कहते हैं नहीं ठीक हो गया, सुन हो गया तो कोई बात नहीं, वो सुन हो जाता है, मतलब बॉडी इज गिविंग यू सिग्नल कि आंखों में अंधेरा आ गया, तो उसको इग्नोर नहीं करना चाहिए। कहीं वीकनेस हो उसको इग्नोर नहीं करना चाहिए। अगर बोलने में कोई डिफिकल्टी है आपको, वो भी इग्नोर नहीं करना चाहिए। वो एक लक्षण है कि लोगों को ब्रेन अटैक हो सकता है, इसको कहते हैं TIA या रिवॉल्विंग स्ट्रोक या फुल फ्लैश स्ट्रोक। और सिमिलरली जब चलते हैं आप तो आपके काफ में काफ़ी पेन होता है, अगर जिसे हम कहते हैं क्लॉडिकेशन, बहुत ज़्यादा पेन होता है, आप चल नहीं पा रहे हैं ज़्यादा, प्लीज़ गो टू द डॉक्टर। तो बहुत ज़्यादा होता है, स्पेशली स्मोकर्स में ज़्यादा होता है, बिकॉज दे आर सफर फ्रॉम व्हाट वी कॉल एज बर्जर्स डिजीज। तो उन लोगों को भी ख्याल रखना चाहिए कि डिजीज ना हो। हमने ऐसे पेशेंट देखे हैं कि वो खाना खाते हैं, खाना खाने के बाद सीवियर पेन हो रहा है एब्डोमेन में। इसका मतलब ये है कि जब खाना खाते हैं तो वहाँ ज़्यादा ब्लड चाहिए इसको डाइजेशन के लिए, ब्लड पहुँच नहीं पाता है क्योंकि जो नाड़ियाँ हैं उसमें कोलेस्ट्रॉल जमा हुआ है, उसे हम कहते हैं एब्डोमिनल एंजाइना। तो सब प्रकार की चीज़ें हैं, बहुत इंपॉर्टेंट है, इनकी जानकारी सारी चीज़ें होना चाहिए। तो यू शुड गो टू ए वेरी गुड एक्सपर्ट डॉक्टर।
बट सर मैंने एक चीज़ सुनी है कि जैसे जो आपने टेस्ट बताए सारे, इको हो गया, TNT हो गया या एंजियोग्राफी हो गया, इनमें भी ब्लॉकेज 80% प्लस हो तभी आता है, 80% तक नहीं आता है, इज दैट ट्रू?
बट हिस्ट्री इज़ वेरी इंपॉर्टेंट. इफ सपोज इसको एंजाना पे एफर्ट होता है, मतलब उसका ब्लॉकेज 85% से कम है. लेकिन डिस्टेंस डिपेंड करता है. अगर पहले वो 1 माइल चलता है फिर डिस्कम्फर्ट होता है, फिर आधा माइल चलता है फिर डिस्कम्फर्ट होता है, या 2 फीट चलता है फिर डिस्कम्फर्ट होता है, मतलब ब्लॉकेज बढ़ते चला जा रहा है. उसका थ्रेशोल्ड कम हो रहा है. थ्रेशोल्ड, अगर थ्रेशोल्ड लंबा होता है तो इसका मतलब ब्लॉकेज कम है. और अगर 85% या 80% से कम हो तो कई लोगों को सिम्टम नहीं होते हैं, सिर्फ सीढ़ियाँ चढ़ेंगे तो सांस चढ़ेगा, ब्रेथलेसनेस होता है. तो जिसको ऐसे तकलीफ भी हो डॉक्टर को जरूर जाना चाहिए. इन शॉर्ट आई शुड से कि आफ्टर द एज ऑफ 40 और 30 if anybody has symptom like this, please consult your doctor.
At what age and what test a person should start doing?
According to me, after the age of 30 we should do a complete metabolic profile. इसमें ब्लड शुगर होता है, थायराइड टेस्ट होते हैं, यूरिन होता है, सीआरपी होता है, वी डू इंसुलिन टेस्टिंग, वी डू कंप्लीट हीमोग्राम, सब चीज़ देखते हैं उसमें. और हर एक पेशेंट का डिटेल लिपिड प्रोफाइल होता है, केएफटी, किडनी फंक्शन टेस्ट, सब चीज़ें होती है. इसको बोलते हैं मेटाबॉलिक प्रोफाइल. अगर किसी की फैमिली हिस्ट्री है तो हम कहते हैं एक होमोसिस्टिन टेस्ट होता है. होमोसिस्टिन हाई देयर वल्नरेबल द फैमिली, तो उसके भी चेक करना चाहिए. ये सब चेक करके कॉर्टिसोल टेस्ट करते हैं, हार्मोन टेस्ट करते हैं, स्पेशली फॉर फीमेल पेशेंट्स वी डू एस्ट्रोजन, प्रोजेस्टेरॉन, एवरीथिंग. और sometimes after the age of 40 we also do cancer test like CA125 in ladies, PSA in males. तो इसका एक पूरा पैकेज होता है. वो पूरा पैकेज मेरे ख्याल से हर एक इंसान को आफ्टर 30 एवरी ईयर, और आफ्टर द एज ऑफ 50 और 45 every 6 months. I am 73, 74. I get every 6 months my complete testing right from head to the toe, so that I know that I am fit or I am unfit. And I work for 14 hours a day. And I am here every day in the hospital for the last 45 years. So God is very kind to me only because of my awareness on the heart health.
अब now I want to understand sir कि जैसे आपने बताया पूरा like प्लान जम जाता है and then it bursts out and everything. So that's what heart attack is happening. उस heart attack के समय ये होता है. क्या क्या ट्रीटमेंट्स हैं? अब let's talk about the treatments also. जैसे stent angioplasty आपने बताई और दूसरा bypass surgery भी है. So first of all I want to understand from your point of view कि एक लेवल्स होता है ना कि लाइक दिस इज मेजर हार्ट अटैक, तो अब आपका बाईपास होना है या अभी आपका इतना नहीं, आपके स्टेंट करना है. सो कैन यू जस्ट एक्सप्लेन अस दैट?
In the beginning, when a patient gets a heart attack, as I mentioned to you, there are 3 or 4 important drugs which you should take. And after taking those drugs, we do an angiography and see the extent of blockage. If you find the blockages are significant, then they have to put on angioplasty and we put on a stent. 1 stent, 2 stent or 3 stent. They are drug-eluting stent or metallic stent.
स्टेंट क्या होता है?
Stent is like a small tube, छोटी सी होती है ट्यूब, जिससे वो रास्ता खोल देती है, उससे ब्लड जाता रहता है, उस नाड़ी में हम डाल देते हैं उसको, फिर फ्लो ठीक जाता है और वो चलता रहता है. फिर ये जो स्टेंट होता है ये एंडोथेलाइज हो जाता है और उसके थ्रू ब्लड चलता रहता है. ये हम एक हमारी जो नाड़ियाँ होती है देयर मिलीमीटर्स, राइट कोरोनरी और लेफ्ट कोरोनरी और लेडी और सर्कमफ्लेक्स और ब्रांचेस. So this is another one. We also do these days what we call as laser angioplasty. We evaporate the plaque, उसको बर्न कर देते हैं.
तो ये नॉन इन्वेजिव
कोरोनरी में ये भी. And number 3, we also do atherectomy. Atherectomy जो एथीरोमा है, जो प्लाक है, उसको निकाल देते हैं, सक कर लेते हैं उसको. And number 4, very rarely we use in some patients, and it's very important, especially when there is a microvascular disease. We do various kind of therapy, and we do only rarely these days bypass surgery, because we can put stent everywhere, in the left main, in the LAD, in the right coronary artery, circumflex, everywhere. And there are so well designed and well structured stents available these days. They are flexible, not even rigid, and they are even dissolvable. So there are dissolving stents available in the market. Itni advanced technology.
So they open it and then they get dissolved.
So this is the new technology these days. And then long term, after the stenting, they should do lifestyle measures and they should take statins for a life. Atorvastatin or rosuvastatin, aspirin for a lifetime. So far as the Tecaconazole is concerned, we give it for at least 1 year. And after that, if the patient is fine, you can put them only on aspirin.
The one you mentioned is blood thinner.
Blood thinner, that to take. And then beta blockers are very important. Like the drug of beta blocker means which reduce the heart rate. जो धड़कन कम करता है वो बेस्ट मेडिसिन जो आजकल है बिसोप्रोल. Bisoprolol is a very superior drug. And then we give for a hypertension some ARBs or ACE inhibitors. और अगर heart failure साथ में तो we use ARNI and SGL2. SGL2 is a very important drug these days, inhibitors. And nowadays the new drug is coming now, which is known as semaglutide. Semaglutide is a GLP-A receptor agonist, very important drug. It is for weight reduction. अभी 5 दिन पहले हमारी यूरोपियन सोसाइटी कार्डियोलॉजी कॉन्फ्रेंस हुई लंदन में कि जो भी पेशेंट को हार्ट फेलियर हो उनको SGL2 इनहिबिटर देना ही है. अगर वो ओबीज हो, मोटे हो, तो उनको सेमाग्लूटाइड देना चाहिए. उससे उनका वेट कम होगा, उनका हार्ट फेलियर कम होगा और लॉन्जेविटी भी लंबी होगी.
आफ्टर स्टेंट जो ब्लड थिनर्स और ये सब बोल रहे हो चलती सब लाइफ टाइम थी, बट इनका फिर कोई साइड इफेक्ट तो होता ही होगा.
हर एक मेडिसिन जो लेते हैं उसके साइड इफेक्ट होते हैं, जिसके लिए आपको टेस्ट करना पड़ता है. जैसे मैंने बताया आपको कि टेंडेंसी ऑफ ब्लीडिंग ज़्यादा तो नहीं है, वो हम मालूम कर लेते हैं. और कोलेस्ट्रॉल बहुत ज़्यादा लो तो नहीं हो गया. कोलेस्ट्रॉल बहुत लो हो गया हो तो उसको डोज को टाइट्रेट कर देते हैं. So that's how they have to come for a follow up. Like the doctor patient just told, he comes to me every 3 months. Stand लगा 3-4 साल हो गए इसको. लेकिन all the way he come from Jodhpur and he's doing fine. He's about 46 now, 45. He's doing very well.
No. And what about bypass surgery, sir?
या bypass surgery उनको लगाते हैं हम जिनकी तीनों वेसल ब्लॉक्ड है और कैल्सिफाइड है और हार्ड कैल्सिफिकेशन है और लेफ्ट मेन पे गई है. उनको हम bypass surgery करते हैं. Bypass surgery means कि normally we take a venous graft from the legs or we take internal memory artery from the chest. उसके हम ग्राफ्ट बनाते हैं. एक तरफ से जो आर्टरी ब्लॉक है उसके ऊपर से जो नॉर्मल आर्टरी है और जहाँ तक एबनॉर्मल जहाँ फ्लो है वहाँ तक लगाते हैं जहाँ डिस्टल रन ऑफ अच्छा हो रहा है. सो दैट जो सेगमेंट खराब है आर्टरी का उसको हम बाईपास कर देते हैं. और इसकी भी लाइफ वैसी होती है, कम से कम 10-12 साल तो निकाल लेते हैं लोग. बाय डूइंग बाईपास सर्जरी वी आर नॉट गिविंग ए न्यू हार्ट. वेसल्स आर सेम, आर्टरीज आर सेम. वीनस में चांसेस क्लॉट के ज़्यादा होते हैं, आर्टरी में कम होते हैं, बट दे हैव टू टेक ऑल द मेडिसिन्स.
So sir, one thing I want to ask you is, generally जो हम recently देखते आ रहे हैं, one thing is celebrities को जो heart attacks आ रहे हैं, and second उसमें दो assumption आते हैं. One is because of excessive workout and excessive gymming, and second is protein powder.
This is a very important question, Aruna. You just asked me now. I think gymming heart attack is a nomenclature now. कि जिम में लोगों को हार्ट अटैक क्यों होता है. Similarly, film stars or sports personalities, why do they get heart attack? The only thing they get heart attack only because they are sportsmen. They are visible. And film stars because they are visible. A common man is not visible. But those people who are visible, they have a lot of stress. They have very fast life. They don't take proper sleeping hours. And they are targets to fulfill. And they are subjected to fast food or no food. Times they keep on working, starving. They are dehydrated, no water. Like we are dehydrated. I'm very happy. Your colleagues give me water. So hydration is very important. Yeah. One should consume 2 liters of water every day. If you dehydrate yourself, you are bound to have clotting there. When you do too much of exercise, you sweat. And then you dehydrate. Tendency for clotting is high. And if you have high cholesterol, more tendency. If you have high blood pressure, more blood pressure. Your pulse becomes fast. So all these things happen in gymming because there is a system known as SNS, sympathetic nervous system, in everybody. That becomes hyperactive and they get fast pulse rate, very hard. Heart beats 100, 1200 or 1000, ventricular fibrillation in sudden cardiac arrest. It was very painful when I learned about Rajiv Sethi just few days ago, who was a TV artist. At the age of 48, he died in sleep. No exercise. But died in sleep. That means his body is so exhausted that even in sleep also it is exhausted. His sympathetic system is very active.
What happens when somebody dies in sleep because of heart attack?
Only thing is their system, in sleep actually, there are 5 phases. One is known as a waking stage, which you and me are. Then there is a dreaming stage, and then there is a sleeping stage. Then there is a soul searching, what we call as Turiya. Then there is a cosmic consciousness. Then there is a divine consciousness, and there is unified consciousness. They are all the 7 stages of sleeping. There is a stage known as a rapid eye movement when we sleep. If Rajiv Sethi had something like obstructive sleep apnea, in sleep, he is obese, for example, and if had a breathing stops for a minute, so there is hypoxia. There is no oxygen supply to the brain or to the heart. Sudden death. One of the very important causes is obstructive sleep apnea. Or they are extremely exhausted and very fat, and sugar is fluctuating in the body, uncontrolled diabetes, uncontrolled hypertension. They are more prone to get and die in sleep. Or if there is a strong family history, so they are vulnerable to get all these problems.
पर इनको सर सोने से पहले कुछ तो होता होगा, कुछ भी नहीं होता. So
Unfortunately, in obstructive sleep apnea, there are not many symptoms except that they have some feeling of dizziness, and they don't take a cognizance of it. They don't take a note of it. And that's how they fall victim. Sleep apnea is a very, very important cause. The only way we should know whether you have sleep apnea or not is do sleep studies. Where we see the heart rate, we see the blood pressure. Say, for example, if we do an ambulatory blood pressure, we do home blood pressure monitoring, we do ambulatory blood pressure monitoring, or CBPM. CBPM means you take a blood pressure in the clinic. So there is a white coat hypertension. But at home, if you take, there is a right blood pressure. And when you sleep in the night, suppose you are in stress, so your blood pressure become very high. Normally, when you sleep, the blood pressure should dip down by 20 millimeter of mercury, which is not the normal dipper. But there are some people who are non-dippers. Their blood pressure become high. Or some are extreme dippers, and the blood pressure become too low. So reverse dippers, then the blood pressure become very high. They are more prone to a sudden death because they don't supply in the body. To prevent the stroke like heart attack or brain attack, blood pressure should be normal. And to prevent the heart attack, the rhythm should be normal. This is known as pulse rate variability or heart rate variability, blood pressure variability, LDL variability. The variability should not be at the extreme. It should be a very mild range. Nothing is fixed in our body. Everything is variable. But if it is extreme, you are bound to get a heart attack. That's what happens in gym. They go to the extreme. Sudden death.
तो सर उसमें जैसे आपने बोला कि 1000 या 1200 तक उनका हार्ट रेट चला जाता है, because lot of wearable devices have now come कि जैसे बीपी मॉनिटर करते हैं, हार्ट रेट मॉनिटर करते हैं. तो आप क्या बोलोगे कौन सा एक लेवल है कि इसके बाद तो तुम्हें पहले रुकना चाहिए, पहले तुमको नॉर्मल करना चाहिए?
Wearable devices are good to enhance the awareness, but they should not make you psychic. Because I know an industrialist, very big man, he's a CMD. All the time he was looking at the device. What is my heart rate? What is my blood pressure? We should not become like that. They should take only morning, evening. They have an idea. They can see what is the sum of variation in the daytime and what is the sum of variation in the night. And accordingly, they should go to the doctor and get the modification of the drugs. But if the pulse rate variability is more than 30, doctor should consult. Similarly, the blood pressure variability, if it's more than 20 or 30, they should go to the doctor. So blood pressure variability and heart rate variability are the most important prognostic markers of a premature heart attack or premature brain attack. So that has to be seen. So they are important, but to such an extent that one should not be glued to them all the time. We have to work. We are human beings. We are here to work, to do our karmas. But all those things should be considered. Otherwise, there is a lot of scope of variables, and it may help us to monitor our system, especially in those, like I see a lot of women, who are more sensitive. Women are sensitive. I don't know whether you agree with me or not. So they are highly vulnerable, and so we tell them, okay, you put on a device and see how much is maximum heart rate, and we give some drug like beta blockers, like bisoprolol, and they drink the drug, and then we optimize the heart rate, and they do very well in life. They don't. So they need the optimization of drug therapy and optimization of lifestyle. They should not have fit of anger. They should not hit their children, and of course they shouldn't hit their spouse also. Sometimes they hit their spouse also. So that's or in the office when they are working. So all those precipitate triggers. In fact, in Instagram, I've given about 150 messages, 1 minute message. What are the triggers for hypertension and heart rate? Just to make awareness in the people. And I keep on putting in the Facebook as well as on the Insta, your LinkedIn, so that people watch, and the response is crores.
इसमें मैं एक चीज और पूछूंगी जो आपने टेस्ट बताया कि वी शुड हैव द होल लिपिड्स एंड एवरीथिंग पूरे टेस्ट होने चाहिए सो टेस्ट में लाइक यू मेंशन सारे टेस्ट में ऐसा कोई स्पेसिफिक है कि लाइक कोलेस्ट्रॉल इज वन थिंग कि हाई है तो समथिंग इज इशू इन योर देयर इज सम इशू इन योर हार्ट सो ऐसे कोई इफ यू सी कि थ्री थिंग्स दैट यू रियली शुड think at least see and go to the doctor.
Three things are very important. Number one, blood pressure variability. If your blood pressure is high, very important. It is the most powerful predictor of mortality, high blood pressure, uncontrolled. Number two, uncontrolled sugar. Number three, uncontrolled lipids. And fourth, uncontrolled heart rate. Also, sympathetic drive. If sympathetic drive is very fast, I remember a doctor who was working with me as my fellow, and he told me, "Sir, I want to go to army." I told him, "Civil में काम करो, क्या इतनी stress होती हो?" He didn't listen to me. He was kept at Srinagar border, and within 6 months he came back. Heart rate 180, 190.
Continuously.
Continuously. Stress, bombardment, gunshots, fear, psychosis. So this is very important. Fear is the main cause of everything. We brought him back. I got him relieved from the Short Service Commission. He's fine now. He's working with us in the hospital.
And there has been one more myth about the vaccine also, and the corona vaccine. Like a lot of people have been saying that because of corona vaccine, a lot of heart attack cases that happen.
No, it's a very good question you're asking me. The main issue in COVID was there is something like endothelitis. The arteries, there's the endothelium. It gets inflamed. And the coronavirus itself was pro-inflammatory, pro-thrombotic, and pro-immunogenic. So all the people who suffered from COVID, they died because of clot. Either a clot here, the heart attack, or there is a clot in the lungs, or there is a clot in the brain, or a clot in the legs. I remember one of my patients in the second wave, he had a heart attack and brain attack together. Chartered accountant, 32-year-old. One more patient of mine, Arya, I can't forget that. He had DVT, clot in the veins, he had a lung embolism, he had a heart attack, and he had a brain attack. All the four, he died. So that is coronavirus. When we give vaccine, your question is, we did a study in our institute, and we find that 1 to 2% of patients, they are more prone to get a clotting because the coronavirus vaccine we make is a inactivated virus, dead virus or live virus. So they are more prone to get clotting. And the prevalence rate of clotting is 1 to 2%. But the benefits are how many? 98%. So benefit versus risk we measure. The benefits are more and the risk is less. So we bring it to the market. Whether it was Covishield or Covaxin or from any other Pfizer or any other brand, they all came in the market, and this India is saved because of vaccine only. So whatever we achieved is all because of vaccine. There's a revolution from the management. Vaccine made us live today.
And what about other vaccine की बात करें कि जैसे ये जो मेडिसिन होती है, पेन किलर्स बेसिकली जो होती है, पेन किलर्स का भी कुछ इफेक्ट किडनी से तो होता है, हार्ट से भी होता है. Because lot of people take a lot of like those stress pills, so headache and headache pills, almost those.
Lot of painkillers are responsible for heart failure.
They are.
Because all the painkillers not only cause the kidney damage, When they cause kidney damage, they cause high blood pressure. And when there are high blood pressure, it affects the heart and may cause heart failure in number of patients. I remember an old person who came to me. He had some joint problem. He went to an orthopedic surgeon. He prescribed me some drug. I wouldn't want to name the drug. And next day he came to me with swelling in the legs, swelling over the face, and the cause was that painkiller is produced. And he stayed here for 3 weeks to set him right. And he's paid a bill of 4 lakhs rupees. So one pill can make you sick like a heart failure. You have to be very careful. Ideally, you should go to a physician or a cardiologist before taking the drug. Best painkiller which you must take freely is paracetamol. Paracetamol is very safe. Paracetamol is a good simple way to remember. There are many drugs and there are many names. So you can take that, and I think very safe. And painkillers have definitely hazardous effect. I don't believe in any painkiller for my patients. If at all I have to give, I give only paracetamol. Very safe, at least in our age group. Patients who come to me are mostly beyond 45 or 50. So I'm very reservation for this.
So salt intake, salt and sugar intake.
Yeah, very good point. Very good.
Yeah, तो इन दोनों का कितना?
Yeah, I think this is a very important point which was not touched. Salt. There are some people who are salt sensitive. And nobody should consume salt more than 4.5 grams per day. If anybody takes salt more than 4 grams per day, then salt retention make you vulnerable for water retention within you and cause victim of high blood pressure and a heart failure. So all the drugs which we give for control of hypertension is we do natriuresis, means let the sodium pass in the urine. We use diuretics, especially like chlorthalidone. And this drug is a wonderful drug. It causes reduction or accretion of sodium in the urine.
But what about black or pink salt they can people are using?
The best thing is we should use common salt, which is iodized. We should never use rock salt or black salt. Very bad. They are full of sodium. One should never take rock salt or black salt. They are very rich in sodium. If at all you take, please take iodized branded salt and see the composition. They are iodized. They have no problem.
And what about oil?
I believe a lot in the blending of the oil. Blended oil means like a rice bran oil or safflower oil. When they are blended, they have a lot of antioxidants and they have a lot of omega-3 fatty acids, omega-6 fatty acids, and omega-9 fatty acids. And all essential acids are very, very good for all of us. But how to use them is also very important. What are the methods by which they meet are also very important. Some are refined, some are unrefined. They use a centering technique or they use what we call as a filter technique. So many techniques are there. Our aim is oil should not contain any trans fats. Palm oil is very bad. It's condemned, banned. And the same way, the palm oil is banned in US and the Western world. In India also, it should be banned. It is not banned so far. But the best oils are like olive oil, very good oil.
Olive oil में cook भी कर सकते हैं.
Yes, why not? Olive oil, safflower oil, or sunflower oil, they are very, very good. And according to me, they fulfill the criteria of requirement of ratio of omega-3, omega-6 and omega-9.
Because when we have read this also, we should not use oil only. I mean, back then we used to cook everything in water itself. Because our body itself produces so much oil that we don't need extra oil. That's what
There was one Dr. Dean Ornish who wrote a book on prevention, regression and reversal of heart disease. He says no fat and no oil. So I think we need some oil in our life and good oil. For example, you take dry fruits, they all contain oil. They are good oils. So they contain omega-3 fatty acids. You take cashew nut, you take almond, or you take walnut, they all contain oil. They are oily base, but those oils are good phospholipids. On the contrary, those oils which are detrimental for us are only those which are rich in saturated fat. We should take monounsaturated fat and polyunsaturated fat. So these oils which I'm just naming you, I won't tell you the brands again, but there are so many brands.
I was about to ask you, आप कौन सा use करते हो?
So if you ask me, I take safflower oil, rice oil blending. Blending is very good, and I think every 3 or 4 months you should change the oil. That's the best way of doing it, and I use less oil. You should take 1 to 2 teaspoons for 24 hours. So that's the best way. That means you're not using excessive oil. But to cook something, you need some media.
2 more products. One is milk and one is egg. In दोनों को.
I think so far as egg is concerned, one should take white of an egg. I take 2 egg white every day without a miss for last 40 years. And milk is concerned, I think we don't need milk after the age of 30 or 40. Milk also contains saturated fat. You must take milk products like you can have lassi. It's very good. I take almost every day. It's a fermented milk or curd, and too much of milk is not good for health after a certain age. And milk is for children. Why should we take our right? Children should take milk. Why at our age? If you take milk in a tea, then where is tea? And if you take tea in a milk, then where is milk? We don't know what we're taking, tea or milk. So if you take tea, only tea, no sugar. If you're taking milk, only milk, no sugar, no tea. Choice is ours. The best is tea only, without sugar, without milk.
I mean, wonderful, sir. So many myths are broken and so much detailed information has been given कि लोग जो ऊपर से समझते ना बेसिक चीजें, ये इनमें बहुत ऐसी चीजें होंगी जो शायद ऊपर से सुनी होंगी लोगों ने, बट डिटेल क्योंकि डिटेल नहीं पता, लाइक यू मेंशन अवेयरनेस नहीं, इसलिए people don't go into it. Last question I just want to ask you, what message do you want to give the person, the youth who's watching this episode? How can we change?
Anona, I express my gratitude and thanks to you. That is my first message. You had been extraordinary and you had been very lovely and very lively. I could see you stress-free in the dialogue and in the interaction. And you enjoyed every component of our interaction. The second thing, on the occasion of World Heart Day, I feel that we should launch various missions. We should launch mission attack heart attack, so that people understand what we're talking about.
Mission attack heart attack.
Heart attack. How to attack heart attack.
Wow.
And then mission hypertension care. Very important. We should also launch something like mission cholesterol fitness. The banner under whom we are working is Zydus. This should be number 1, to launch something like mission cholesterol fitness, which is the need of the hour. And mission heart failure care. We should use all the media, print media, read the newspaper articles, which I do very often. I do in magazines, I do in the newspapers. Many articles I wrote, hundreds of articles. Similarly, All India Radio, television. In fact, I appeared many times on television. And of course, digital media. I'm very happy that your message is not only vocal, and not only local, not only focal, but a global. So I feel we should inform, perform, reform, and transform the whole world with healthy heart. स्वस्थ दिल, स्वस्थ भारत, और वो हम सब के हाथ में है, वो बाकी किसी के हाथ में नहीं है. So we should have that intelligence and that awareness. That is what we learned on the occasion of World Heart Day. And I'm very grateful to you for your wonderful interview. Thank you very much for being
Thank
with
you so much, sir. Namaste, sir. Welcome to Healthy Hour with Zydus.
थैंक यू मैम.
और आज जो वर्ल्ड हार्ट डे है, तो उसकी अवेयरनेस पहुंचाने के लिए हम ये पॉडकास्ट कर रहे हैं, जिससे कि लोगों तक जितना, क्योंकि जैसे हम बात कर रहे थे, जितना एक्सपीरियंसेस से लोग सीखते हैं, आई थिंक दैट्स द बेस्ट थिंग, वो अपने में इम्प्लीमेंट करना चाहते हैं. और अभी हमारी HK चोपड़ा सर से बात हुई रिगार्डिंग हार्ट हेल्थ, जो कि एक मेजर कंसर्न है अभी स्पेसिफिकली इंडिया में, तो उसे कैसे सुधारा जा सकता है. तो आपने रिसेंटली, आई थिंक 3 years बैक, आपने सर के साथ ट्रीटमेंट ली है, राइट? तो एक बार मैं सर आपसे समझना चाहूंगी, फर्स्ट ऑफ ऑल अरुण सर, आप करते क्या है, व्हाट्स योर प्रोफेशन?
प्रोफेशनली मैं एडवोकेट हूँ. और जोधपुर राजस्थान से बिलोंग करता हूँ।
हाँ जी। तो फर्स्ट टाइम आपको जब ऐसा पता चला कि आपका हार्ट इशू है, तो क्या हुआ था? व्हाट वर द सिम्पटम्स? व्हाट हैपेंड?
कुछ पसीना आया था और थोड़ा-सा अनकम्फर्टेबल महसूस हो रहा था। तो मैं वहाँ हॉस्पिटल गया, हॉस्पिटल में मेरा ईसीजी किया गया तो उसमें मुझे बताया गया कि आपके ब्लॉकेज है 95%। हाँ जी,
95%। उससे पहले आपको कुछ
उससे
नहीं था?
पहले कुछ नहीं था आपको।
ओके।
तो क्योंकि हम लोग चोपड़ा सर को पहले से जानते थे, हमने वो रिपोर्ट उनको भेजी और मुझे एयरलिफ्ट करके दिल्ली लाया गया। कि हमने जोधपुर में हम लोग ट्रीटमेंट 20 साल से चोपड़ा साहब का ही ले रहे हैं। मैंने आपको बताया था जैसे मेरे फैमिली कंसल्टेंट हैं। तो घर वालों ने इनसे कंसल्ट किया और नेक्स्ट डे हम लोग दिल्ली आ गए थे। और 3 साल से मैं चोपड़ा साहब के साथ ही हूँ। हर 3 महीने में एक बार आता हूँ, रूटीन चेकअप होता है मेरा। बाकी मेरी ज़िंदगी बिल्कुल क्लीन है, कोई दिक्कत
तो
नहीं।
आप कहाँ थे, मतलब जब आपको ऐसे हार्ट चेस्ट
मैं कोर्ट से आ रहा था तो मुझे थोड़ा-सा अनकम्फर्टेबल महसूस हुआ था। तो
अनकंफर्टेबल
हाँ
हुआ
जी,
और पसीने जैसा
पसीना
फील?
जैसा हो गया था।
तो आपने पर कैसे इसे रियलाइज किया कि आपको मतलब कुछ
नहीं, मैं ऐसा सोचा नहीं था कि मेरे को कोई कार्डियक प्रॉब्लम हो सकती है।
हाँ, वही, क्योंकि
क्योंकि
जनरली ये होता है।
क्योंकि मैं नॉन-वेज नहीं लेता, मैं ड्रिंक नहीं करता, मैं वेजिटेरियन हूँ, तो मुझे ऐसा लगा नहीं था। मैं तो एक जनरल चेकअप के लिए गया था हॉस्पिटल में।
तभी चले गए थे आप?
हाँ, मुझे अनकम्फर्टेबल ज़्यादा लग रहा था तो मैं एक बार ईसीजी कर मतलब नॉर्मल चेकअप के लिए हॉस्पिटल गया था, तो वहाँ मुझे पता चला सडन कि मेरे को कार्डिक हो गया है। तो मेरे एल्डर ब्रदर ने सर से बात की और नेक्स्ट डे हम लोग दिल्ली पहुँच गए थे।
नहीं, मतलब ये आपने एक डिसीजन बहुत अच्छा लिया कि उसी समय आप चले गए, क्योंकि जो जनरली आपने बोला, जनरली ये होता है कि लोग ये सोचते हैं मैं फिट हूँ, मैं कुछ गड़बड़ नहीं करता, मैं जो स्मोक नहीं करते, और तो मैं कुछ नहीं करता, तो ये तो पॉसिबल ही नहीं है। दैट्स व्हाई दे थिंक कि कोई हल्का सा मामूली चेस्ट पेन होगा शायद।
मैं काफ़ी डल महसूस कर रहा था अपने आप को, मुझे शरीर में कुछ अनकम्फर्ट लग रहा था और पसीने ज़्यादा आ रहे थे, तो व्हाट आई थिंक कि मेरा बीपी शायद डाउनफॉल में चला गया है, ऐसा कुछ हो गया है। और क्योंकि मेरे फैमिली हिस्ट्री है, मेरे फादर को कार्डिक हो रखा है, तो मुझे थोड़ा-सा अवेयरनेस था मेरे को इसमें। इस कारण से मैं एक बार चेकअप कराने गया था और वहाँ से फिर हम लोग दिल्ली आ गए थे।
फिर दिल्ली आए, फिर यहाँ पर
हाँ
आपने
जी।
सर को दिखाया, उस दिन आपको इमीडिएट
हाँ जी।
एडमिट कर
हाँ
दिया।
जी।
एंड देन व्हाट हैपेंड? एंजियोप्लास्टी हुई, क्या हुआ, क्या ट्रीटमेंट्स, कितने
एंजियोप्लास्टी
दिन
हुई
लगे?
थी, एक स्टंट लगा था, मुझे 5 दिन यहाँ रखा गया था। उसके बाद मुझे जोधपुर भेज दिया गया था। फिर मैं मेरा जो रूटीन है वो फ़ॉलो कर रहा हूँ। मैं अभी भी प्रैक्टिस अभी भी कर रहा हूँ। हाँ, थोड़ा डिसिप्लिन ज़रूर आ जाता है ज़िंदगी में, वो आ गया है। जैसे पहले वॉक नहीं करते थे, अब मॉर्निंग वॉक करना शुरू कर दिया, बीपी थोड़ा कंट्रोल रखते हैं, खाने-पीने का थोड़ा-सा ध्यान रखते हैं। ज़्यादा तला हुआ नहीं खाते क्योंकि हम जोधपुर लोग खाने में थोड़े अलग से होते हैं, तो खाना-पीने का थोड़ा ध्यान रख रहे हैं, बाकी सब नॉर्मल है।
तो आपकी ऐसे पर जो एंजियोप्लास्टी हुई उसमें आपके स्टेंट लगा
हाँ
है,
जी।
तो आपकी कुछ ऐसी दवाइयाँ हैं जो लॉन्ग टर्म आपके चल रही हैं, या हाउ इज इट, क्या
वो
होता है?
सर हर 3 महीने में सेम टैबलेट्स ही दे रहा है मेरे को। जो 3 टैबलेट्स, एक ब्लड थिनर है, एक बीपी का है और एक विटामिन सी की गोली है। उसके बाद 3 के अलावा और कुछ नहीं है इसका असली।
ओके। और आपका ऐसे मतलब कैसे इमोशंस कैसे थे सर आपके, जब आपको पहली बार पता चला कि आपके 95% ब्लॉकेज है, और क्या
मैं
फील हुआ था
मैं
आपको और आपकी फैमिली मेंबर?
आपको फैक्ट में अगर बताऊँ तो अगर आप मेरे घर पे अगर बात करते हैं तो हम लोग एक ही डॉक्टर को जानते हैं, वो हैं एच के चोपड़ा। अगर हमारे घर में कुछ भी प्रॉब्लम, कैसा भी प्रॉब्लम हुआ है तो हमने इनको कॉल किया है, तो जब हम इनके पास आ जाते हैं तो हम सोचते हैं हम फिर सेफ एंड में आ गए हैं। तो उसके बाद हम कुछ दूसरा सोचते नहीं हैं। और वो चाहे कोई भी प्रॉब्लम हो, चाहे कार्डिक हो या कोई और हो। मतलब मेरी पूरी फैमिली के डॉक्टर्स जो है, मेरे फादर से लेके मेरे बच्चों तक के, उसमें हम लोग डॉक्टर एच के चोपड़ा के अलावा किसी से कंसल्ट करते भी नहीं हैं। दिल्ली में, जोधपुर में भी कोई अगर एसओएस हो जाता है हमारे साथ में तो हम पहले सर को फ़ोन करते हैं, उसके बाद हम कोई एक्शन लेते हैं। अगर ऐसा लगता है कि कोई मैटर सीरियस नहीं है तो हम जोधपुर में दिखा देते हैं। ऐसा नहीं जोधपुर मेडिकल नहीं है, लेकिन अगर सर ये कहते हैं थोड़ा सा क्रिटिकल है तो हम लोग दिल्ली रन कर लेते हैं।
बट ये बहुत अच्छी बात है सर कि आपने मतलब एक तो आपके पास, मैं तो लकी बोलती हूँ कि आपके पास सर हैं,
हाँ
क्योंकि
जी।
बहुत बार एक वो जो चीज़ आती है ना कि कहाँ जाए वो, क्योंकि आप रेगुलर कंसल्ट करते आए हो, आप वो ध्यान दे रहे हो उस चीज़ पे, तो कंटिन्यूसली आपके पास है कि आप जाओ और पूछो, दैट्स अ वेरी गुड थिंग। तो अभी आपके लाइफस्टाइल में जैसे आपने बोला कि आपने खाने का चेंज किया है, वॉक, क्या प्रीवियसली आपका क्या लाइफस्टाइल था इन टर्म्स ऑफ, एक तो आपका क्योंकि जो जॉब है आपकी वो बहुत, जितना मेरे को समझ आता है, काफी स्ट्रेस फोकस्ड है।
प्रीवियसली इतना स्ट्रेस, प्रीवियसली इतने सीरियस नहीं थे मैम। मतलब वॉक नहीं करते थे, खाने पीने में सब कुछ खा लेते थे, वेजिटेरियन जो भी होता था, घी खा लेते थे। बट जब हुआ था तो वो जो 7 दिन थे वो थोड़े स्ट्रेसफुल थे। लेकिन यहाँ आने के बाद मैं पूरा कंफर्ट हो गया था, क्योंकि सर के पास आने के बाद में सर ने मुझे इतना रिलैक्स कर दिया था कि मुझे और कुछ सोचने की ज़रूरत पड़ी नहीं। और उसके बाद भी मेरी अभी तक कोई सेकंड ओपिनियन नहीं है, मैं अभी भी यहीं पे कंसल्ट करता हूँ, हर 3 महीने में एक बार आता हूँ।
जोधपुर से आप दिल्ली आते
हाँ
हैं?
जी।
अच्छा।
और नॉर्मल जो टेस्टिंग होती है वो सर टेस्टिंग करके और टैबलेट सेटल किया हुआ उन्होंने। कभी नहीं आता हूँ तो ऑनलाइन कंसल्टेंसी से काम हो जाता है।
अच्छा, और आपने वॉक और ये सारी
हाँ
चीज़ें
जी।
इनकॉर्पोरेट
हाँ
की हैं
जी।
अपने लाइफ में। आई थिंक दैट्स वंडरफुल। और आप कुछ कहना चाहेंगे उन लोगों के लिए जो शायद इस चीज़ में, या यूथ, क्योंकि आजकल बहुत ऐसी चीज़ें कि हार्ट प्रॉब्लम बहुत ज़्यादा पर हुई है, तो जो लोग शायद नहीं ध्यान देते, तो आप क्या बोलोगे उनके बारे में कि क्यों ज़रूरी है? और जैसे आप सेव वर्ड, सो दे कैन ऑल्सो बी सेव, सो व्हाट डू यू हैव टू से ऑन?
डिसिप्लिन बहुत ज़रूरी है मैम। एक चीज़ तो, पहली चीज़ तो लाइफ में जो भी आप कर रहे हो उसमें डिसिप्लिन अगर नहीं होता है तो आप बहुत रिस्क में रहते हो। और ये रिस्क ऐसी है कि अगर आप कोई गलत हाथ में चले जाते हो या आप कोई गलत मेडिसिन में चले जाते हो तो फिर रिकवर होना बहुत मुश्किल है। तो मेडिकली एक अच्छे मेडिकल एडवाइजर से अगर आप एडवाइस ले रहे हो और अच्छे मेडिसिन अगर आप यूज़ कर रहे हो तो आप को, और वैसे मेरे हिसाब से जो जैसे सर कहते हैं कि आफ्टर 40 आपको हर 6 मंथ में एक बार टेस्टिंग करवा लेना चाहिए, क्योंकि ये चीज़ किसी के साथ भी हो सकती है, फिर आपकी फैमिली जो है वो काफ़ी प्रॉब्लम आ जाती है।
हाँ, इट्स लाइक एक तुम्हारे साथ पूरी
हाँ।
फैमिली एक
हाँ
उसमें आती। उससे पहले आप बिल्कुल टेस्ट नहीं कराते थे कुछ भी?
नहीं नहीं, उससे पहले कुछ बीपी भी
कुछ
चेक नहीं
भी?
कर रहा था, नहीं कभी कुछ
बीपी
नहीं
भी
करता।
चेक नहीं करते थे, और अभी आप थॉरोली बीपी
अब
अपना मॉनिटर रखते हो?
अब तो सर मुझे बिल्कुल डिसिप्लिन बिल्कुल
हाँ।
सर ने बिल्कुल डिसिप्लिन कर दिया मेरे को। हर 3 महीने में मेरा रूटीन चेकअप होता है।
हाँ, नहीं, थैंक यू सो मच सर। आई मीन आपने ये चीज़ जो बताई है कि लोग कैसे आपने अपना स्विच किया, बट फर्स्ट जो एक मेन इंपॉर्टेंट चीज़ मुझे लगी कि आपने राइट टाइम पे एटलीस्ट ये एक्सेप्ट किया कि शायद मैं कुछ नहीं करता पर शायद ये हो सकता है, और आप करेक्टली आप डॉक्टर के पास गए। तो दैट्स वन थिंग जो बहुत इंपॉर्टेंट है लोगों को, कि ये मत सोचो कि मुझे कुछ नहीं हो सकता, और ये भी मत सोचो कि मुझे सब कुछ हो सकता है, बट एक न्यूट्रल, एक तो मैं थॉट प्रोसेस आई थिंक रखनी पड़ेगी। सो थैंक यू सो मच, आपने अपना एक्सपीरियंस शेयर किया, यू ओपनड अप अबाउट इट, and wish you all the happy health to you. And thank you so much for
Thank you
joining
very much.
us.